Hello, my name is Mary Copeland and welcome to The Road Ahead. Through a series of guests, we're going to help you navigate your own road ahead as you age. We will help you and your aging parents prepare for your journey. Let's face it, no one wants to find themselves in a crisis mode simply because they did not have access to information well in advance. As the publisher of Compass and Clock, we will help you achieve your best future. Today, our guest is Dr. Garrett Soames, the co-owner and founder of HouseCallMD. Garrett has been a practicing physician assistant for over 17 years, with over 17 years of clinical experience, I should say. And his schooling is extensive. Undergraduate education in sports medicine at Washington State University, master's degree in physician assistant education at Emory University School of Medicine, and he completed his doctorate in medical science at the University of Lynchburg. In addition to all of that, Garrett also practiced medicine on the continent of Africa for 13 years, and there he achieved multiple postgraduate fellowships for Pediatric infectious disease, Neurovascular and stroke care, and emergency medicine. Garrett was born and raised right here in Kitsap County, and we're thrilled that he founded HouseCallMD in 2018 right here in Kitsap. Welcome to The Road Ahead, Garrett. I'm so glad you could join me today.
Yeah, I'm glad I could join you too, Mary. Thanks for having me.
Yeah. So today, Garrett, you and we are going to educate our viewers on telemedicine and house calls. So can you briefly tell our viewers what telemedicine is? And what does a house call look like these days in 2020?
Sure. Yeah. So the basic premise of telemedicine is exactly like you and I are doing right now. Is we're using video conferencing software, and this way you and I can directly converse with not just the audio but also the visual aspect. And so telemedicine was originally created with the intent for specialists to then assist with primary care in remote locations. It was originated in the United States, though it actually sort of really took off in India, and where some of the, again, specialists like cardiologists and whatnot could then converse with both the physician and the patient in remote villages. And so they found that the ability to add the expertise of a specialist in a location where that specialist normally would not ever go, it started to slowly gain in popularity. And currently, right now in 2020, after the coronavirus pandemic, telemedicine has exploded rather significantly because patients now are able to basically get the care they need, in the fact that a lot of patients don't require a physical exam for some of the more basic things like blood pressure checks and stuff. And then your question regarding house calls. So yeah, house calls themselves went by the wayside. You basically, with the advent of private insurers, they refused to pay for that service. And so in the 1950s and 1960s, house calls were actually more prevalent than a clinic visit. So 60% on average of all patients seen in the United States at that time, again, before 1960, about 60% of all visits were at a patient's home. And again, as things changed with the payment models and such, it slowly but steadily transitioned to the point where the majority of patients were seen in clinics and hospitals, and then finally where insurers completely, absolutely stopped paying for house calls. And then what that did is it left a lot of people struggling to be seen in their homes. And they would have to pay like a concierge type medicine or a physician, out of pocket because insurance wouldn't pay for it. And even today, insurers they really struggle to want to pay for it, but recent laws were enacted, so house calls are now able to be covered at close to 100% of what they would be paid for in a clinic. And so the problem is the physicians and nurse practitioners and stuff got comfortable sitting in their, their clinic, and so there are very few practices that do house calls anymore. And so that still leaves a lot of patients struggling to find transportation and go and sitting in a waiting room and then traveling to the pharmacy after and all that. And so it took a lot of the convenience out of it.
Okay. Thank you for a very thorough explanation of both telemedicine and today's house calls and its history. So let's focus on telemedicine for a moment.
Mm-hmm.
What are the benefits and drawbacks of telemedicine?
Okay, yeah. So the benefits of telemedicine is, well, the main one is convenience, right? So what we know about telemedicine is, for example, in clinics that are currently using telemedicine, the no-show rate, the traditional no-show rate, so when someone doesn't show up for their scheduled appointment, averages anywhere between 10 and 15%. So about 10, 15% don't show up for their appointment. With the advent of telemedicine, no-show rates drop to about 3 to 5%. So, and the reason for that is, again, if I don't have to leave my home, it's easier for me to just answer a telemedicine visit from my home. So the convenience alone has increased the access to care. Patients are more likely to actually get the care they need. Again, the care is in some senses it's equivalent. Then again, one of the drawbacks of telemedicine is it lacks the data that is often needed for a more accurate diagnosis. Unfortunately, telemedicine for acute care things, so if I need to diagnose you with something new, if it's not something pre-existing, like we need to talk about blood pressure or your diabetes, things that are already existing. If I need to actually diagnose something like listen to your heart and lungs, or examine, your back or a rash or whatever, telemedicine is lacking, unfortunately. That is the main drawback of telemedicine. In fact, one largely, a widely done study was they had over 1,000 patients go do a telemedicine visit for an acute symptom, like it hurts when I pee. That's could be a UTI, could be bladder infection, could be yeast infection, could be a number of things. The accuracy rate of a telemedicine visit for an acute care symptom is 21%. So telemedicine is great for chronic care. In fact, it's equivalent from the studies. The care is equivalent. But if I need to do a physical exam, if I need your vital signs, I need to know what your blood pressure is. I need to know if you have a fever or not. If I need to look in your ear and see, if you have an ear infection or if it's, wax buildup or whatever's causing your ear pain, if I need to see your throat or I need a strep test, I can't do that via telemedicine. So that's the main drawback.
But, and this I'm just throwing out there, and you can basically probably say yes or no. But when you combine telemedicine with house calls, then they are a great partnership with each other, because if somebody calls your company and you started off with a telemedicine and they think it could be an acute thing, you can get some basic information up front. And then when the nurse and other staff member go to the patient's home, they're there with them and telemedicine you or somebody else on your staff. So you're using them in conjunction with each other so that all boxes can be checked and you can help the patient, correct?
Yeah, correct. So HouseCallMD is actually the first company to utilize that aspect of telemedicine. We're titling it augmented telemedicine. There might be a better name out there, but that's what we're calling it. Is we augment telemedicine we have staff members who would come on site and facilitate that visit. For example, I had 2 patients just this morning who were in a long-term care facility, an assisted living facility. One of these patients can't drive. They have some problems with dementia. And certainly they don't know technology at all. So they couldn't manage a telemedicine visit without someone there to actually facilitate the actual telemedicine call. They don't know how to use Skype or Zoom or FaceTime or any of that. So telemedicine is not something they could do without us, because they just can't do it. They don't navigate technology well. And so one of the patients had a wound that needs wound care. So I can then give the order remotely to the staff member, and they can clean the wound, or, they can apply steri strips, they can apply a wrap gauze, they can, clean it out, they can do numbing gel, whatever. And then they can properly take care of the wound, where if they just, again, if it were traditional telemedicine and they were able to manage the camera and everything, and they just show me the wound on, then I could just say, well, you have to clean it like this, and you have to apply it. You have to go to the pharmacy, go get this type of gauze, and then apply the gauze like this. And again, so if something needs to be done, traditional telemedicine can do that. With house calls, we do it like that. And again, another thing we use, or we try to use technology to its full capacity. So we use digital stethoscopes. So we actually have stethoscopes that record heart and lung sounds, and then that technician would then send those heart and lung sounds to me. And again, that's more data for me to make an appropriate diagnosis. If you have a cough, and I can't tell you, is that pneumonia? Is that, bronchitis? What is that cough? But if I have the technician send me the heart and lung sounds, and if there's wheezing throughout there, oh, it sounds more like maybe, a bronchitis. Or if there's an area that has gurgling, and then, oh, that sounds more like a pneumonia. Over telemedicine, I wouldn't be able to have that data at all. I wouldn't know if they had a fever. I wouldn't know what their oxygen saturation is. And so, yes, our augmented telemedicine, our goal is to increase that diagnosis accuracy rate from 21% to the more traditional above 90%, like you would see in a traditional clinic.
Okay. So a lot of the information you gave me is answered some of the questions that I do have here for you. So why don't we jump into what has changed recently to healthcare with the response of COVID-19? I think a lot of your answer probably, it could be short because it has to do with what we were just discussing. Is that correct?
Yeah. So the response to COVID, again, the problem with a pandemic, or any contagious illness, is that if we're asking the community to go and get tested, we're also asking the community to go out and get exposed.
Right.
And so the main change that coronavirus has changed, at least for us, as being the only house call company in Kitsap County that does coronavirus testing, is, again, we've gotten rather busy. Again, the benefit is we're not exposing people. If it's a simple visit, we often just collect the swab on their doorstep,
Mm-hmm.
and we'll wear full PPE and stuff, so we're not exposing them and they don't expose us. And then we just take it to the lab and we get our results. Whereas, going to a waiting room, sitting there with other people who may be getting testing for coronavirus or whatever else, the exposure rate is much higher. And so, that's kind of the main change, is that people have been a lot more timid about, going to the doctor's office, knowing that they could catch this very, very contagious, virus, and they're a little more timid. And so you've probably heard in the news, a lot of, hospital systems and stuff are actually furloughing their workers because they don't have work for them, because people stopped coming in because they're scared. So a lot of people aren't even visiting the doctor's office anymore.
So that's how COVID-19's really affected the healthcare system right now. And with that said, you chose house calls to focus as your business model, and boy, timing was perfect for that. You didn't know that when you launched it in 2018. So I'm assuming, like you said, you're really busy these days, and hopefully the word's getting out that you are available to service the community for that exact situation. They don't want to go into a healthcare provider's office for fear.
Yeah, yeah. Again, I had no clue that coronavirus was coming, but I did when I was when I was marketing it, that my business HouseCallMD before is I was using the flu as an example.
Mhm.
So they have done studies on how likely are you to catch the flu if you go to a doctor's office. They've done plenty of studies on it, and more than any other place in the entire community, in a school or at work, a bus, in your a public, a bus or something, more than anywhere else, you're more likely to catch the flu in a doctor's office or an emergency room. In fact, up to 300% more likely. So you're more likely to catch the flu and develop symptoms within 3 to 7 days if you visit your doctor just for your blood pressure check. And so, we know now that the coronavirus is far more contagious than influenza is. Again, and we know coronavirus is here to stay. It's mutating in the same fashion as flu. So this is now gonna be a regular seasonal thing for us, unfortunately, and so we're gonna have to adapt. And yeah, I didn't anticipate this when I started House Calls. I thought it would be better for convenience and getting access to people who are disabled and can't drive and whatnot. But in reality, I think others are going to see this model and they're going to probably copy it pretty quick, because there's a lot of patients that just aren't going to be comfortable sitting in a waiting room and being coughed on.
So the three main reasons that you started the HouseCallMD was convenience,
Mm-hmm.
um, accessibility or
Yep.
mobility issues, and wanting to be available during the flu season so that folks would not be going into the doctor's office, and hopefully you would lower the amount of flus in the region because you're having them not go into the doctor's office.
Yeah. Yeah. This if you really break it down, this model saves. If we were to expand this model across the entire United States, we could probably save hundreds of millions of dollars of Medicare, Medicaid dollars, because we're preventing infection by preventing people from getting exposed.
Mhm.
We're also saving hundreds of millions of dollars in transport fees. If you need if you're disabled, or you're in a wheelchair, or you're elderly and you can't drive, getting a transport through what we in healthcare call a cabulance, to and from that clinic visit, that's at least another $100, in transport fees, just, and, um, again, a lot of times, again, if it's after hours is a good example. After hours visits, where are you going to go? The ER, it's the only place open. And the average visit to an ER costs no less than $800, and often up to several thousand. So and if you're on Medicare or Medicaid, you're going to bankrupt the system across the entire nation. You're going to bankrupt the system real quick. But again, if you need to be seen after hours and it's something we can manage, HouseCallMD will come out and do that. And we only charge the regular copays and regular fees that any other doctor's office would. So,
So time is a major benefit here too, the time saver for all of this. Um, Garrett, normally we keep these around 10 minutes, but your information is so invaluable. We've gone way more past that, but I do want to ask you just another question as we're
sure.
wrapping up. And that is, do you think that healthcare has gotten more or less accessible with time, and has it gotten less personable with time?
Sure. I think access to healthcare is actually pretty good at least in developed nations in the United States. I think access is pretty good. But the thing is, access is good for the general populace. But the general populace is not everyone. I have a patient who is blind. He can't drive. He has no family members around that can drive him to his doctor's visits. Um, he hadn't seen a doctor in over 6 years before my service, and we diagnosed him with diabetes. He didn't know he had it.
Mhm.
Um, I have a double amputee. He really struggles to get around. He said he can make it to doctor's offices, but it generally it's an all day affair. Getting someone to come and drive him and stuff. So, and then again, the elderly struggle. They may not feel comfortable driving anymore due to, vision problems or, a number of things. And so there are a lot of people in the community that aren't getting care. And so, yes, for the general population, access to healthcare is pretty good, but there is a large segment of the population where it's not.
And there's also we've talked a lot more about this end of the age spectrum, but, you could be a young mom at home with 3 kids and they're all under the age of 4 and one of them gets hurt and there's only one car in the family and you're home with the kids. What are you going to do? How are you going to get the one that's bleeding at the knee taken care of? Well, they can call HouseCallMD. You can do the telemedicine. They can look at the wound. You can give the mom directions, and then, peace of mind and a kid that's going to be on the mend then. So it's all ages.
Yeah, absolutely. Yep.
So go ahead. I was going to say that's all we had time for today. So I would love you to wrap up with something that you want to share with them that we haven't gotten to yet.
Sure. Well, again, actually, maybe to even just answer that last question about being personable, I do think that healthcare has lost its personal touch. And to touch back again to the telemedicine thing, that's the least personal aspect of telemedicine, is the hands-on aspect of healing. Is if someone's there to actually, care for you and to lay hands on you and, to actually be there to care for you, that personal aspect, again, is what HouseCallMD is trying to bring back to telemedicine. A lot of companies are just seeing it as a gold rush for money, and it's easy because I just sit at home and I can talk to the patients. No, we're bringing back the personable touch to healthcare and telemedicine. And so, and I hope that again the word gets out, because we're busy, but we're expanding, and we're going to do our best to care for everybody in the community.
Yeah, and you're also changing the lives of people in the community for the better. That patient, the gentleman that's blind, that hasn't seen a doctor for 6 years, you just changed his world. And hopefully he'll continue to have a better quality of life because you diagnosed his diabetes. If that went undetected, that man wouldn't be long for this world, probably, depending on the level of diabetes he had. So your personal touch, your house calls, your telemedicine is what we need. And bravo to you for launching it here in Kitsap County for all of us. I'm greatly appreciative of it. So.
Well, I'm glad, and thanks for having me again, Mary. I appreciate it.
Yeah, no problem. We should sign off and say goodbye to our audience. So thank you, Garrett, so much for spending a few minutes with me today and for educating all of our viewers on telemedicine and on what today's house call looks like. I will be posting this video on our Facebook page and our Compass and Clock website page. But Garrett, why don't you give everybody the phone number that they can call for you for HouseCallMD and the website, please?
Sure. Yeah. You can reach us. Our general number is 833-432-5633. And we can get you scheduled via the phone, or you can always schedule online at our website, which is housecallmd.org. And you can also actually download our app, which we can get you scheduled and verify your insurance and everything through our app. And again, you just look us up on the App Store, and it's HouseCallMD.
Fantastic. Thank you for all your time today. I know you're really busy, so have a great weekend. And to you, our viewers, stay happy, stay healthy, and stay safe. Until next week. We'll see you soon. Bye-bye.